Hello, my name is Dr. Saib Gallagher, and in this video I'm going to give you some tips on what to do if you're struggling with dilation. And this is not medical advice. Always talk to your own surgeon. They know your anatomy better than I do, but I'm just going to tell you about some things we suggest to our patients if they're having difficulty with dilation. And typically the difficulty is in the beginning when you're obviously not used to dilation, sometimes because of scar issues or maybe stenosis means narrowing or other issues. You may develop problems later on, and that's always a time to talk to your surgeon, get a visit, just get a heads up, or explain to them what's going on. But if you're in the early days, things are very swollen down there. So first of all, one of the things that is really the bane of any sort of genital surgery is how much things swell. And how I explain it to patients is if we operate, let's say, on the hand may swell to like double the size. That's not unusual. We keep it elevated, it gets better. Genitalia, it can easily swell to 4 times the normal size, and there is no way to easily elevate it and get that swelling out. So swelling sticks around for a long time after bottom surgery. It's why I personally usually don't do revisions or labiaplasties or any of that until at least a few months after the initial surgery, because the swelling has gone down and everything is changing. And as you can imagine, when we create the new anatomy and then everything swells, well, it can be tough dilating in the first few weeks after surgery, and that's when you're learning how to do it. So usually my patients will take about 6 weeks off work after vaginoplasty, and a lot of that time is devoted to learning their new anatomy, figuring out dilation. And I would say probably the most important thing when it comes to dilation is patience. You have to be patient with your body and with yourself. So I always say, if you're having a bad session, first of all, if nothing seems to want to go up there, it's not finding its way up there, take a break. We tend to, when we get stressed, our muscles tighten up, including the muscles in our pelvic floor, and we can get into this kind of downward spiral where it just gets more and more difficult. So if it's not happening, if you're experiencing pain, that's, just take a break, come back later. And so my next tip is we can always downsize. So most of our patients, in general, every girl's anatomy is different, but usually we'll start on the second biggest dilator. Now, unlike other medical appliances, the colors in these packs, these dilators, don't mean anything. They're different in every pack, so we can't talk about the orange dilator or the purple dilator. It means nothing because there's no standardization. But this is the second smallest dilator. A lot of patients will start on this, but it's totally fine to go down to the smallest one. One of the things I always say to patients is depth is probably more important at first to maintain that, especially when you're very swollen, rather than girth or width. So if you're able to get the smaller one in, great. If you're struggling with this, the next best thing may be a finger. And same thing, you could start with the middle finger or the index and go all the way down to the pinky. And at this point, if this is going on for a while and you're really failing to dilate, definitely time to call your surgeon, because we really don't want to wait too long because we could lose the vaginal canal. Now, how long is too long? It really depends on the individual patient. I don't really have a specific answer, but I would say in general, in patients who have lost a lot of depth, usually we're talking about 2 weeks on average, they took off dilation. But again, it's different for every patient. So in that situation, you don't want to let it go too long before talking to your surgeon, figuring out what's going on, and maybe getting the help of a pelvic floor physical therapist, for example. Another trick one of my patients taught me years ago was you can put these bad boys in the freezer as well, because things are swollen down there, so it almost acts like an ice pack as you're dilating, and some patients like that. Again, if you're having issues, make sure you contact your surgeon, fill them in, and they can usually talk things through. A lot of my patients who are out of town, we might FaceTime to give them a little tips and tricks, and usually we can troubleshoot that way. Shameless plug for my book, Affirmed, which this was actually written with 9 other experts in the field, and it has our vagina manual in there. It's available on Amazon, with just a bunch of different tricks and tips I've gotten over the years from other surgeons, my patients, pelvic floor physical therapists, and lots of helpful things in there. Best of luck. It's a chore at first. Most of my patients tell me it just becomes part of their routine, just something they get used to. And don't forget, if you're really struggling, make sure you reach out to your surgeon.